Our prevention and protection services, focusing on equity and supporting families to provide families with the supports they need so that foster care may not be necessary for us to keep children safe. But we know that there are still some children in our community that do need foster care. And we need to equally focus on the well-being of children and families and the equity in our foster care system. So, this is where all of you wonderful, amazing, compassionate, loving people come in. As resource families and our community partners who support our resource families, all of you have stepped up to help provide a safe home, stability, care for our kids, and really answer the call to do something meaningful in your lives and support our children. We also started the Quality Parenting Initiative to make sure that we could really strengthen the partnership between all of you, our social workers, our department, our community partners, because it takes so many of us working together in order for you to be an amazing caregiver. We know the support that you need, and we continue to strive to try to make sure that you have all of that support. It has now been 11 years since we have adopted Quality Parenting Initiative. And there are just a few things that are happening just right now that I want to highlight about some accomplishments. May 1st, we officially rolled out our placement binders for resource parents, so those will be coming soon. We've hosted the QPI Champions Conference last September, and we are slated to host again in November of 2024. We had 21 staff and resource parents trained as QPI champions. We developed a wallet-sized resource card for our workers and all of you. And we formed a transition work group to make suggestions on how to improve practices and update policy. On a national level, and I can truly say this, I was literally with the commissioner for our federal agency, the Administration for Children and Families, this week. San Diego is truly seen as a leader in our Quality Parenting Initiative work. We are on the forefront of all the work because of what you do, the way that you partner with us, the way that you share what it is that you need, but also those solutions. What's going to work? How can we be innovative and creative so that we get to the best outcomes for our kids? You play such a vital role in the care of our children and have really been a huge part of the transformation of our department. Whether it's meeting their medical and dental needs, we have more than 90% of our kids in compliance with getting those exams, meeting our social and emotional needs of our children, and providing the permanency for our children through guardianship and adoption. You give them stability and nurturing and love. I also want to particularly recognize our relative caregivers in the room. All of you usually got asked to step up to the plate, probably pretty unexpectedly. And so we thank you for doing that. All of our caregivers are incredible, but I know there are some particularly unique needs of our relative caregivers. As we've changed our system, I just want you to understand how important it is and the work that you do, and a few other data points that I think are particularly telling about the changes that we've made in our system. So as of today, right now, we only have 19 children at Polinsky Children's Center. Just a few years ago, we regularly had about 100 children at Polinsky Children's Center. So look at what you have done. You have opened your home to find a place for all of these kids, because we know kids do better when they are in a family setting, when they have those connections to their community, when they can stay in their same school. So thank you. Thank you for being a huge part of finding solutions for that.